So if you ever thought, what happened to my sex drive? You are absolutely not alone. And no, this is not stress or just aging. So welcome back to the channel. It's Dr. Durst, and I specialize in peptides, wellness, and sexual wellness. And today we're going to talk about PT-141. This is a peptide that can help with your sex drive when it's a low sex drive or low desire, because no, that's not normal. And it's not just because of stress or aging. Well, I guess before we get into that, what is a peptide? So a peptide is an amino acid sequence that acts like a neurotransmitter or hormone in the body and gives the body back what it needs. And so the one that we're talking about today is PT-141. And generically, it's called bremelanotide. And this is one of the most fascinating therapies for women in sexual desire because it challenges the very common assumption that low libido in women is always hormonal, and it's not. It's not an estrogen. PT-141 is not testosterone. It's not progesterone, but instead it works in the brain on the melanocortin receptors, and those are neuropathways that are involved in desire and libido and arousal and sexual motivation. And it's very simple language. This medication can help strengthen the brain's neural interest signals for sex. What's even more interesting is that this was FDA approved in 2019 for women with low sex drive, but that was for premenopausal women with low sex drive. And then just recently, they expanded that to include postmenopausal women up to the age of 65 with a low sex drive or desire. Why 65? No good reason for that. But also, why are we just talking about a peptide for low sex drive? But at least we're talking about low sex drive. So many women experience reduced libido, and it can be hormones, but sometimes the hormones are normal. I will say this, that with women versus men, that desire and sex drive are the first things to go when their hormones change, where it's the last things to go with men. And so in practice, we're frequently addressing a change in libido or desire that is really affecting a woman's life. And it really does depend on brain chemistry. It depends on life, what's going on, the stress, the neurosignals, but also arousal and orgasmic strength. That all plays a role. The sexual response for women is very complex, but the brain does play an important role, and that's where PT-141 comes into play. So if we're optimizing a woman's hormones, but sexual desire is still slow to come back, then we actually need to consider peptides such as PT-141. And I will say that about a third of my patients don't respond to just hormones alone. And so the other thing about PT-141 is that even though it increases that sex drive, it also increases responsiveness, arousal, better mental engagement, but also just better orgasmic strength. But you're not forcing it. You are actually just helping your body respond in a more natural way. So it's super helpful for use in patients and women with perimenopause, menopause, hormonally optimized, but still have a low sex drive, chronic stress, relationship issues. Obviously, that's an important and hard thing to treat, but this might potentially help because sex is play and there's love in play. And so sometimes if we can actually get their brain neural pathways better aligned, that sex drive and desire might increase, and then maybe potentially even the relationship connection comes back. So one of the biggest myths I think about women in sexual health is that loss of libido is inevitable. It is not. It is not something we need to lose with time. It's not normal if it's not normal for you. And just know that there are things that we can do to get that sex drive back. We can look at your hormones, definitely in that perimenopause, menopause. We can look and see what kind of medications you're on. And even if we are hormonally optimizing, or if there's patients that we can't, then we can consider PT-141. So just know that if that is a problem that you are having, that you have a low sex drive, you're wondering where that desire went, this isn't a magic desire drug, but it does help your brain normalize its pathways and increase the desire and potentially help you increase that relationship once again through that sexual connection. So the thing that I will say about PT-141 is I think all women love it, but when? So there's that timing issue. So it might work in 30 minutes, it might work in 5 hours. You have to find what timing is best for you. And then also the side effects that can be common, such as flushing or nausea. You will acclimate to those, but then potentially you don't want that to happen on some special trip or special occasion. So definitely play with this peptide while you are, in a comfortable routine so that you can actually check timing for you and then control those side effects. So basically, if you have experience with PT-141 or you want to ask other questions, let's start a conversation in the comments below. And just remember that I am willing to deep dive into anything peptides, wellness, and especially sexual wellness, and especially sexual wellness with women. So thank you for listening.